So the goal of this video is that you get a new set of habits that will improve your oral status, your oral health, and give you a new perspective on how can you better treat and clean your teeth, and you can clean your, let's say, crowns or implants or bridges if you have in your mouth, and how to avoid any more problems regarding gingivitis, periodontitis or dental cavities. Here are my tips and tricks on how to provide you with better habits for teeth cleaning and how you can clean your teeth better and why. So if you stay till the end of this video, you will get a better knowledge and experience on how to approach your mouth and how to clean it all together better. So that the next visit at your dentist is going to be a short and a boring one, because there's nothing to be repaired or treated in the mouth, just a simple boring checkup until the next time. So I hope you will enjoy the video. So when you look at the mouth, before you can see anything, did you know that there are over 700 different types of microorganisms living in complete harmony in the mouth? But when you have something, let's say foreign, like a food in this area that we chew and eat, this food provides a development of pellicula, plaque and food retention in an area, where then bacteria is formed and takes that food, which slowly eat it away. They use that food as an energy source for their metabolism in producing different types of, let's say, acids, and that causes drops of pH level, which you can see in different types of commercials regarding, let's say, some chewing gums. When they show you a drop of a pH scale, this is something, if you saw that type of commercial, now you know why they talk in a commercial of a drop of a pH level. Those things can all cause cavity development and infections. So if you want to learn more about how cavities develop and everything, you can check my other videos. So back to the topic. When you look at the mouth, you can see different types of tissue inside. Tooth, you have gums, you have cheeks, you have the tongue, your palate and everything else. But this is not where the story ends. The connections between those tissues and the hidden parts of all those tissues are really important for teeth cleaning and cleaning of your mouth, so you could reduce those areas of food retention. So can you reduce the areas of plaque accumulation, and then eventually reduce the chances of getting infections and cavities and gums to bleed or periodontitis. So when I ask my patients how many surfaces does a tooth have, they say 2, maybe 3, but that's not true. The tooth has 5 surfaces. One that's staring at your cheeks or your lips, one that is staring at your tongue, 2 interproximal areas, and one bite surface, or a incisal edge that is reserved for the frontal incisors. So other than that, there's some gums surrounding the teeth, the periodontal ligament, the periodontal tissue. This is also really important. And why do the problems then start? If you have all those tissues and they're positioned in your mouth and you clean your teeth, then why still sometimes you come at your dental office and at your dentist and he says you have a cavity or your gums bleed in a certain area, you did not clean well? How is it possible? Because I cleaned everything that I saw. So not all teeth are in a good pattern. Some of them are misaligned. Sometimes people have fillings, they have crowns, pontics, bridges and everything else, implants, and all those things require special attention and care and need regarding cleaning your teeth and regarding cleaning those areas and those connections between your tissue, the organic part, and the prosthodontical anorganic part. Those places are often missed via toothbrush or bad flossing or bad mouth washing, and cause then eventually inflammation and cavity and gingivitis, periodontitis development. So then patients, when I explain to them that they have a cavity, sometimes they try to avoid the responsibility that say, but doctor, I think I have bad teeth because I have bad genes. Sometimes this is also true. Bad genes can result in a different type of tooth development that is called that's your structure of your dentin, which is the middle part of your tooth, and your enamel is structurally different, let's say inferior to the normal teeth, and it's called dentinogenesis imperfecta and or amelogenesis imperfecta. Sometimes you have one, sometimes you have both, and there are graduations of those genetic anomalies from cases that cannot be seen by the naked eye till severe cases that are also combined with other symptoms and syndromes regarding your general health. But even with bad genes, if you use your toothbrush properly and you mechanically clean your teeth well, the cavity development and infection rate is really low, even then. So when they say I have bad genes, no, you have bad habits and we need to change those habits. So how do you brush your teeth? So us professionals know several different techniques on how to properly brush teeth regarding specific situations in the patient's mouth, but for this video I will explain to you the most simple one, the simplest one and most commonly used, that will take care of over 95% of your problems. But if you have any, let's say, more fillings, crowns, implants or prosthodontics in your mouth, please visit your dentist to give you the proper information on how to clean those areas specifically for you, because every patient is individual. You can use your normal toothbrush, electric toothbrush, sonic, ultrasonic toothbrushes, I don't care. If you're using a normal toothbrush, the best thing you can do is to have a soft or ultra soft toothbrush, because those toothbrush filaments should be so soft that they can go inside the dental sulcus. This is a space between the tooth and the gums, then where the brush goes inside. So you go at a 45-degree angle regarding lower teeth and 45-degree angle regarding upper teeth, and then you go in a circular movement. So why a circular movement? Because you go inside the sulcus and go out. So you go inside, you collect all the debris and you take it out. You go inside and out, and you can start from wherever you want. The thing is, you want to do a full circle. What does a full circle mean? It means, let's say I start from my right upper molar, second molar, or wisdom tooth, I don't know which tooth is the last in your mouth, and you start from there, from this area, and you go 45-degree angle, circular movement, frontal teeth, other side, from back to your other side, last tooth, behind that, don't forget to go behind that last tooth, clean him, go on the palatal side from the palatus, again 45-degree angle to the palate, circular motions if possible to clean out that area, and finish it off at the area where you started. Same thing goes for the lower jaw. 45-degree angle, circular motion around the lower teeth, around to the other side, behind the last tooth, on the side where the tongue is, clean it again, and that's it. So after you did the 45-degree angle scrubbing and cleaning with the circular motion, you continue on your occlusal surfaces, the bite surfaces of your teeth, especially on distal molars and premolars, where there's really often a rich morphological surface with a lot of fissures and retention areas for food. So this is really important that you clean those areas properly with professional, let's say, scrubbing, but not too hard, like I said before. After this is done, you can continue on your other surfaces. Cleaned free surfaces. So there are two remains. This is the interproximal surfaces, and those are done with, let's say, some electric mouthwashes, or with a dental floss, or somebody uses even those mini toothbrushes. I usually avoid of using them and recommending them because people do more damage with them than benefit. So I recommend a proper use of floss. So how do you floss? You should put the floss between your teeth, and then you have two surfaces to clean. One is the surface of the one side of the tooth, and other surface is on the other side of the tooth. You should never clean in the middle to go down right to the papilla, because you will damage the papilla, and the papilla eventually over time will go away and you will destroy that soft tissue. So you don't do that. So go in a motion of a ypsilon, let's say a reverse ypsilon, depending on which side you're looking at. You go inside, one side, go 1 millimeter underneath the gums, take the floss out. Go again inside, 1 millimeter on the other side, on the other surface of the tooth, 1 millimeter, and take it out. And repeat that for every interproximal area. Sounds like a lot of work, but when you train yourself, it takes much less time than you think. When you're done with it, you then go to use your let's say, so when you're done with it, you can use your mouthwash with a let's say any type of brand that is available today on the market, but just take care of the mouthwash which has chlorhexidine inside. Chlorhexidine is an excellent antiseptic and bacteria killer, and great for periodontal treatments, but use it with care and caution, and consult with your dentist. It can stain teeth really fast and really soon, and you can then remove those stains really hard with only professional help. So only use chlorhexidine mouthwashes in consent with your dentist. One other topic: toothpaste and toothbrushes. So like I said before, toothbrushes I recommend ultra soft and soft, because sometimes people do not know how hard and what type of pressure should they apply to the gums. But if you don't want to destroy the gums, especially if you do a bad brushing technique, let's say a horizontal one, this is completely wrong. Don't do that. Don't do this horizontal toothbrushing, because you destroy your connective tissue between the tooth and the bone and the gums. You want to do the circular motion, nice and easy and slow, and you use a soft and ultra soft toothbrush with these types of filaments. Why? Because if you apply a little bit more pressure, I rather that you destroy those filaments than you destroy your own teeth and your own supporting tissue. This is just my recommendation, and I have better results, and patients have better results with that. Better to buy a new toothbrush than to go on gum surgery in a few months because you wanted to really scrub those teeth with extra hard toothbrushes. The extra hard toothbrushes are really old school, and they were used before because people and dentists did not know that they could damage your soft tissue and surrounding tissue that fast, especially if you apply too much force. And the toothpaste, every toothpaste is good if used properly. I recommend those with more fluoride, of course, and those with periodontal protection. It's labeled on the toothpaste itself. I like to avoid using the ones with whitening potential inside, because it has a lot of, let's say, abrasive particles. So when you overuse those toothpastes for a longer period of time, sometimes tooth sensitivity can form, and then you have problems. Better to clean your teeth professionally at a dentist once every while than to have a chronic abrasive particles on your teeth every day. So if you have any questions regarding how to clean your teeth, topics, or you need some advice on it, you can ask me down in the comment section, or you can message me privately over any type of social media. Hope you enjoyed my video, and you can check my other videos. I will put a link in the description, and subscribe to my channel to learn even more about how to gain better health and stability of your teeth and your mouth, and have a longer and a cleaner and a happier smile. Hope to see you soon. Bye.